for your overwhelming support, due to which we have been able to reach 2,563rd webinar today within 5 years, and within 365 days, 907 webinars. So thank you very much for these two series on women wellness, infertility series on every Thursday, and women is all only on Saturday. So thank you, Kamini ji. Thank you, Professor Kamini Dhiman, former professor and HOD, All India Institute of Ayurveda, New Delhi. And today's speaker is Professor Uma V. Gopal, Professor of Shari Rachana, SDM College of Ayurveda, Hassan. Welcome, madam. Much time. Thank you, madam. Now stage is yours.
नमस्कार पवन सर, निशांत शुक्ला सर, रामवीर सर और हमारे साथ काफी सीनियर लोग जुड़े हुए हैं। आज दिनेश्वर प्रसाद जी भी जुड़ गए हैं। उमा गोपाल मैडम, टुडे स्पीकर, आई वेलकम यू ऑल ऑन दिस प्लेटफॉर्म. This was a specific day was celebrated yesterday, so we decided to take this topic of embryonic development. Embryonic development in relation to gynecology and obstetric is very much important, and as it is related to congenital genetic disorders, it is related to RPL, it is related to continuation of pregnancy. Each and everything is related to early embryonic development. So we must know what are the factors responsible behind that, how a healthy baby can be achieved. That depends upon the early embryonic development. So today we have a very senior professor among us as a speaker, Dr. Uma Gopal madam. She was very much busy today. Even then she has consented. Thank you very much and welcome madam to this platform. And after our presentation, we will have discussion upon this topic and the view of other experts also. Welcome madam. You can share if presentation if you want to share, or you can start your speech. Welcome madam. Madam, can you listen me, Madam Uma Gopal? I am audible to others.
చెప్పండి కార్లో ఉంది. హలో చెప్పు.
Madam, you are audible, madam. Namaste, ma'am. You are audible.
Oh, yeah.
Yeah,
I'm going to
namaste,
share
ma'am.
the screen.
Yeah, madam. Yeah, welcome.
కొంచెం ఓపెన్ అవుతుంది. ఇది ఇట్లా చేస్తే అవ్వలే, ఇది చిత్రంగా వస్తుంది. క్లోజ్ అవ్వాలి.
Madam, mute పెట్టి మాట్లాడండి.
ఓకే, తెలుగు వస్తుందా మేడం మీకు?
నేను రమాన్ మాట్లాడుతున్నాను మేడం. నేను జాయిన్ అయ్యాను గ్రూప్ లో.
ఓహో, రవాణా.
సరే మేడం.
Yeah,
మనందరం
madam,
తెలుగులో
today
మాట్లాడుకుంటున్నాం.
we have lot many senior persons in this webinar to listen to you, madam. Uma madam. Yeah. Till then, Ramamdevi, madam, you can give introduction of this topic, and if you want to say something about madam, you can say something. Tell the madam share the screen.
No, madam. Okay. Uma madam. Uma madam.
Yeah, she is there.
She is there. It seems. I'll see. She is
Yeah.
not joined. She joined.
Yeah, she is there. He's trying to share the screen. Till then, you
Yeah,
say
yeah.
something.
Yeah, no, madam. No, no. Because madam is unable to share. I can talk.
Yeah,
Madam.
you say something.
Ma'am.
Yeah.
Start, madam.
Shall I send the
Even waiting for
PPT to you
your.
directly?
Madam, you
One
can
second,
share.
please.
Send to madam. She will share. Like that, maybe.
That's
I
better.
don't know. You ask
That's
madam once.
better.
You ask madam. Uma madam, you
Okay,
ask
okay.
Kamini madam.
Kamini madam, I'll send by mail. You just share that directly.
Okay.
Okay, I'm going to send. You send your mail ID,
Yeah.
madam?
You WhatsApp me.
WhatsApp.
If you are joining through phone, then you can WhatsApp. Through that, I will manage.
Yeah.
Ramadevi madam, you can say something till we manage the things. रामवी सर, आप ही शुरू कर दीजिए कुछ भूमिका बनाना जब तक मैडम का मैनेज होता है। रामवी सर जी, आप थोड़ा इंट्रोडक्शन दे दीजिए टॉपिक की, थोड़ा शुरू कर दीजिए जब तक ये सब मैनेज होता है।
अपने मैं थोड़ा आयुर्वेद के ऊपर प्रकाश डाल देता हूँ। जहाँ तक अपने एम्ब्रियोजेनेसिस के अंदर अपने जो डेवलपमेंट ग्रोथ और डेवलपमेंट होता है, उसके लिए सेल डिवीजन, सबसे पहले तो अपने सेल डिवीजन, और सेल डिवीजन के बाद में ऑर्गेजेनेसिस, और उसके बाद में ऑर्गेनोजेनेसिस के बाद में अपने उनका डेवलपमेंट होता है। तो मोस्टली ये होता है फर्स्ट ट्राइमेस्टर के अंदर, और उसमें भी फर्स्ट मंथ के अंदर। तो आचार्य कहता है, हमारे आचार्य पे ही आ जाते हैं हम लोग, तत्र वायुर्विभजति तेजनम पचति आपे क्लेदयन्ति यदा हस्तपाद ग्रहण करणितम आदिवे अंगय उपेत तय शरीरम संज्ञा लगे। उससे पहले शरीर संज्ञा नहीं लेता, उस समय से पहले अपने गर्भ की संज्ञा रहती है। तो शुक्र शोड़तम गर्भाशयस्तम आत्म प्रकार संमूर्तम गर्भेत उच्यते। तो शुरुआत में जो एम्ब्रियोनिक स्टेज होती है, तो जहाँ पे जेनेसिस हो रही होती है उसको उन्होंने गर्भ कहा है, उसके बाद में उन्होंने संज्ञा ली है जब ऑर्गेनोजेनेसिस हो गई होती है उसमें। अब बात यहाँ आती है कि जो सेल डिवीजन हो रहा है, डेवलपमेंट हो रहा है, तो सबसे पहले आती है वायुर्विभजति। तो ये सेल डिवीजन हो रहा है, उसमें वायु का महत्वपूर्ण योग रहता है। अगर वायु की अधिकता हो जाएगी तो सेल डिवीजन के अंदर भी डेवलपमेंट प्रॉब्लम हो सकती है, और वायु कम हो जाएगा तो उसके अंदर अपने ग्रोथ धीमी हो सकती है, क्योंकि सेल का डिवीजन नहीं होगा। इसकी यहाँ पर आचार्य ने जहाँ पर वर्णन किया है, तो जहाँ पर अपने अवमानना, दोहर अवमानना करने से वायु की प्रकोप होता है, बात की वृद्धि होती है, तो उसकी वजह से कुणी, पंगु और अपने मिनमिन शब्द का यूज किया है। किस तरह के बच्चे पैदा होते हैं जिसके अंदर पंगु होता है, कुणी होता है, मिनमिन होते हैं। तो इसका मतलब ऑर्गेनाइजेशन के अंदर अपने जो सेंसरी ऑर्गन्स होते हैं उनका सही डेवलपमेंट नहीं होने का कारण उसमें वायु की वृद्धि होती है। और वायु की वृद्धि क्यों होती है? दोहर्द अवमानना की वजह से। दोहर्द अवमानना कैसे होती है? दोहर्द अवमानना का मतलब ही होता है कि गर्भावस्था के अंदर अगर कोई वस्तु की जरूरत है, किसी चीज की कमी है, तो विपरीत गुणेच्छा होती है। महिला को अगर आयरन की कमी है तो उसको आयरन खाने की इच्छा होगी, आयरन की जगह तो मिट्टी पाइका होना शुरू हो जाता है, मिट्टी खाना शुरू कर देती है, कोल खाना शुरू कर देती है। तो ये उसकी विपरीत गुणेच्छा का मतलब है उसको जो आयरन की कमी हो रही है उसको ब्लड अपना भी रखना है और बच्चों को भी देना है। इसी तरह से ग्रोथ होती है बच्चे के अंदर, तो उसको अपना भी न्यूट्रिशन करना है, बच्चे का भी न्यूट्रिशन करना है। तो विभिन्न प्रकार की जो आवश्यकताएं होती है शरीर के अंदर, तो जिन चीजों की कमी होती है उसकी इच्छा होती है। अब उनकी इच्छा को कम कर देंगे, जिन चीजों की कमी हो उनकी कमी हो जाएगी, न्यूट्रिएंट्स की कमी हो जाएगी। उसका परिणाम ये होगा कि बच्चे के अंदर जो ऑर्गेनाइजेनेसिस हो रहा है वो कम हो जाएगा या डिस्टर्ब हो जाएगा या फिर सही तरह से नहीं हो पाएगा। इसका अपने उदाहरण दे सकते हैं, जैसे अपने विटामिन बी टू फॉलिक एसिड है, फॉलिक एसिड की कमी की वजह से बहुत सारी प्रॉब्लम होती है, जिसमें अपने विटामिन बी की कमी से स्पाइना बिफिडा हो जाता है, न्यूरोलॉजिकल डिसऑर्डर्स हो जाते हैं। ये जो चीजें हैं, इसका मतलब है आचार्य ने जो कहा है कि प्रॉपर न्यूट्रिशन के साथ साथ में वायु नहीं बढ़ना चाहिए, नहीं तो उसका विभाजन खत्म हो जाएगा। अब फिर बाद में अगर विभाजन हो गया उसके बाद तो तेज एनम पचती, उसका मेटाबॉलिक रेट होती है, जो मेटाबॉलिज्म होता है, जो सेल का डिवीजन के बाद में सेल का अपने मैचुरेशन होता है, वो अपने उसकी वजह से होता है। तो वायु के अलावा पित्त का भी उसमें वर्णन किया गया, उसका देखा जाएगा कि वायु महाभूत के साथ साथ में पित्त महाभूत भी रहे। और तेज एनम पचती और आपे क्लेदयंती, आपे क्लेदन का जो होता है न्यूट्रिशन के साथ में। तो इसी समय इसी जगह पे उन्होंने एक चीज और कही है, अपने जो भाव कहे गए हैं, आत्मज भाव, उसके बाद पितृज भाव, मातृज भाव, सात्वज भाव, सत्वज भाव और रसज भाव। तो ये जो चीजें हैं ये भी उसमें अंदर पूरा रोल करती हैं कि रस की किस तरह से रसज भाव में किस तरह से उस पर फर्क पड़ेंगे और सात्मज भाव में किस तरह से फर्क पड़ेंगे। आत्मज भाव है वो जेनेटिक डिसऑर्डर्स होते हैं, उनके ऊपर तो कोई ज्यादा अपने वो नहीं कर सकते, रोक नहीं सकते। मगर आज भी आज के समय में जेनेटिक अपने इंजीनियरिंग चल रही है, उसके लिए भी उसमें भी धीरे धीरे करके काम हो रहा है। तो आत्मज भाव, मातृज भाव और पितृज भाव हैं, उनमें ज्यादा अपने रिजल्ट में देखते हुए आत्मज भाव के बाद में सात्मज भाव, सत्वज भाव और अपने जो भाव है रसज भाव है, उनका अगर प्रयोग करेंगे तो मेरे ख्याल से फीटस का डेवलपमेंट और उसका ऑर्गेनाइजेनेसिस और सेल डिवीजन जो है तो उसको सही तरह से कर सकते हैं। तो एनाटॉमिकल देखा जाए तो अपने एम्ब्रियोजेनेसिस जब हो रही होती है, एम्ब्रियो के अंदर विभिन्न प्रकार के अपने जो होते हैं सिस्टम, पहले से सबसे पहले सिस्टम्स बनते हैं, सिस्टम्स के बाद में ऑर्गेनाइजेनेसिस होती है। तो सिस्टम में जैसे एक ही सिस्टम है यूरोजेनेटल साइनस, तो यूरोजेनेटल साइनस के द्वारा ही अपने देखा जाए तो रिप्रोडक्टिव सिस्टम बनता है। तो अगर रिप्रोडक्टिव सिस्टम के अंदर यूरोजेनेटल साइनस के अंदर कोई प्रॉब्लम है तो अपने रिप्रोडक्टिव सिस्टम के अंदर भी प्रॉब्लम होगी, क्योंकि अपने जो अपने ऑर्गेनाइजेनेसिस हो रही है उसके अंदर डिफेक्ट हो गया वहीं यूरोजेनेटल साइनस के अंदर। वो कहाँ होगा? वो होगा अपने मैटरनल और अपने उसमें हो सकता है। तो इस तरह से अपने उसको देखा जा सकता है विभिन्न प्रकार के, जैसे आगे की मैम अपने वो देंगे ही। और ये ना हो पर न्यूट्रिशन जो अपने गर्भिणी पर चर्चा करी गई है वो, और पूर्ति, दो अर्थ की पूर्ति करना उसके लिए जरूरी है। इसलिए हम लोग इसको देखते हुए आचार्य ने जो कही है उसका पालन करते हैं, तो इस तरह की अपनी डेवलपमेंट और ग्रोथ एंड डेवलपमेंट बच्चे का होता है वो सही तरह से। न्यूरोलॉजिकल डिसऑर्डर्स होते हैं कई बार, तो न्यूरोलॉजिकल डिसऑर्डर्स उसमें नहीं होंगे अगर सही तरह से उसके विटामिन और मिनरल्स की पूर्ति होती रहेगी, कार्बोहाइड्रेट, प्रोटीन और फैट, बैलेंस डाइट जिसको कहा गया वो देंगे। मेरे ख्याल से ऐसा मानना है मेरा, और बाकी का जो मैम इसके ऊपर डालेंगी उसके ऊपर अपने विचार करेंगे बाद में। थैंक यू वेरी मच।
Madam, you start your topic saying something. I'll share the screen within 5 minutes, as in when it is transferred to laptop. Okay, ma'am.
वांजिका कुछ तकलीफ है क्या? यस, डॉक्टर उमा वी गोपाल. वेलकम मैडम, वेलकम. Welcome. Now you are visible. Please share your PPT if any.
Myself.
టెంపల్ ప్రకారం పెడతాను వేసంకి లాడు
వాళ్ళే షేర్ చేస్తా ఉండాలి. Next slide, next. 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 Next slide. Okay, am I audible?
Yeah, madam.
Yeah,
Yes,
ma'am.
yes. Audible.
Yeah, audible.
Yeah.
Okay. I am Dr. Uma B. Gopal, Professor and Head, Department of Rachna Sharira, STM. So today I'm going to speak about the modern counterpart of embryology in early stages of development. So first week of development already everybody will be knowing after ovulation as in tube, ampullary part of the fallopian tube. At that time, the sperm, when it enters, one sperm get capacitated, and it will enter, pierce the vitelline membrane of the ovum, and will be efficient enough to enter through the membrane and helps in fertilization. So during the fertilization, there will be 23 haploid chromosomes of present in the ovum and 23 haploid chromosomes in the sperm. So when they come in contact, immediately what happens? There will be this. It is called as pronucleus. Complete nuclear membrane is not formed. That means what? The karyokinesis will not be seen. The cytokinesis occurs immediately. So there will be 2 cell stage on the 0th day of the embryonic development. Then first, second, third, fourth, and fifth, and at the end of the 6th day, it enters into the fallopian tube. So it is covered with the zona pellucida, and as it passes, it traverses through the fallopian tube for about 5 days. During that time, there will be division. What occurs like a 2 cell stage of the embryo will one cell again it will go through the process of division, and the 3 cell stage. Another cell also will divide, and there will be 4 cell stage. So from 4 to 8, 8 to 16, 16 to 32, like that, the cleavage occurs in the early fertilized egg, and then about 32 cells will appear. 32 to 36 cells will appear, and the stage is called as the morula stage. So during that time, it will enter into the uterine cavity. So the first week will be completed by the implantation of the embryo when it is there in the blastocyst stage. Next slide, mate. Next slide. Next slide, please. The second week of human development is concerned with the implantation and the differentiation of blastocysts into early embryonic and placenta forming structures. So in the second week, you can see there will be implantation. From 7th day, it starts from the 7th day, 6th or 7th day, and up to 11th or 12th day, it takes a period of 4 to 5 days for complete implantation in the embryonic cavity. Next slide. Next slide. Which is seen in the second week of development is implantation. It's on the 10th or 12th day. Continuous changes you can see in embryoblast, day 1 to day 14. First 14 days, first 2 weeks. Okay. And also you can see yolk sac formation can be seen. The two cavities are formed, amniotic cavity and chorionic cavity, along with the chorion. Next slide. Next slide. This problem. So implantation begins on the 6th or 7th day and gets 12th day. The continues to divide and produce more syncytial trophoblast that surrounds it. Syncytial trophoblast invade uterine endometrium. Embryo gets uterine endometrium. As abembryonic pole of the trophoblast, that means what? Embryonic pole has already penetrated, invaginated the endometrium after the release of the zona pellucida. So now the abembryonic pole, the opposite pole, as it enters, okay, because of the trophoblast, the epithelium of the uterine endometrium gets covering over it by a fibrin plug. So that you can see completely, it is called as interstitial implantation, what you can see in the human. It's not in the cavity, but it invades the endometrium and it settles there and again grows into the cavity of uterus. Okay, that is called as interstitial implantation. Next slide, please. Next slide. The event seen after implantation of blastocyst, as blastocyst develop further, it gives rise to tissues and organs of the embryo, give rise to number of structures that help in supporting and nourishing the pre-embryonic stage of the embryo. Next slide. Next slide, please. So first one is the germ layer formation. First 14 days, first 2 weeks of development, you can see that the bilaminar disc formation. The disc formation is also called as germ layer formation. So the changes what you can see is related to the epiblast and the hypoblast. The hypoblast helps in formation of the trophoblast, and the epiblast changes what you can see in the embryoblast. That means the inner cell mass. It's called as bilaminar disc formation. Embryoblast cells differentiate into inner cuboidal and outer columnar and organize in the form of bilayered embryonic or germ disc. Single layer of columnar cells called epiblast forms upper germ disc. Single layer of cuboidal cells called hypoblast forms the lower germ disc. Next slide. So it is in the form of two plates which are arranged in one over the other. The inner endodermal cell is called as cuboidal. Ectodermal cells is called as columnar cell. So now next is the connecting stalk. Next slide, please. Next slide. Next. Next. Next, madam. Okay. So here you can see it's a picture. You can see the cells in the outer covering is the trophoblast. The inner green color cells is the cuboidal cells with formation of endoderm, and purple color cells you can see attached on one side eccentrically. Okay, so that is called as the inner cell mass, which is going to develop in the form of embryo. Okay, so during the development, what happens? This endodermal cells, you can see the B. The cells has been differentiated into columnar cells and cuboidal cells. Same kind of cells will be there. that gets differentiated into two types of cells. And you can see a little bit formation of the cavity or amniotic cavity. So there is formation of the amniogenic cells here derived out of the tropoblast, which is related with the ectoderm, or it is also called as epiblast. So epiblast and then the tropoblast. In between them, there is formation of amniogenic cell layer. So between that, there is formation of a cavity, and this is called as amniotic cavity, which is filled with the amniotic fluid or liquor amni. So below the ectoderm, you can see the single layer of cells there. It's called as cuboidal cells, okay, endodermal, which helps in formation of endoderm, early endoderm. And that you can see in the next D slide, the endodermal cells are passing lining the tropoblast on opposite side. Okay, so this will help in formation of the lining membrane of yolk sac. So there are formation of the two cavities, two membranes, okay, and two layers in the tropoblast also. And that is nothing but the tropoblast cells. It is called as cytotrophoblast, and the outer it gives rise to proliferation of cells which occur in the tropoblast, and to settle outside the cytotrophoblast is called as syncytiotrophoblast. So at this layer, in the second week of development, you can see two layers here and two cavities and two disc formation of the embryo. So this is the what we can see in the second week of development. Next slide. Next slide, please. So formation of amniotic cavity, the cells of the epiblast differentiate and forms layer between epiblast and tropoblast. This layer is called as amnion. That is same thing, whatever I explained in the figure. A small cavity is formed, epiblast and amnion. This cavity is called as amniotic cavity. It gets filled with the amniotic fluid. Next slide. Next slide. So formation of yolk sac and extraembryonic mesoderm. Yolk sac formation now. That also I have told you. Cells of hypoblast, that means the endoderm, give rise to flat cells and line the inner aspect of cytotrophoblast. This layer is called exocoelomic membrane. The cavity lined by exocoelomic membrane and hypoblast is known primary yolk sac or primary umbilical vesicle. Extraembryonic membrane give rise to another layer known as extraembryonic mesoderm that lies between exocoelomic membrane and the cytotrophoblast. The cells of extraembryonic mesoderm migrate between the cytotrophoblast and the amnion. Thus, both primary yolk sac and amniotic cavity are surrounded by extraembryonic mesoderm. So this mesoderm is derived out of the trophoblast, which is lining the yolk sac now. So in between the yolk sac membrane and the trophoblast membrane, the cells, these trophoblastic cells only will get proliferated, and it is called as outside the disc, outside. So it is called as extraembryonic mesoderm. So this is called as the mesoderm, which helps in development of, again, the cavity which nourishes the developing embryo. Next slide. Next slide.
మేడం మీ దగ్గర ఉంది, మీరు చదువుతున్నాను మేడం. నెక్స్ట్ స్లైడ్ అనేది చెప్తా, ఆవిడ చేస్తారు, టర్న్ చేస్తారు. సరేనా మేడం? ఓకే, నెక్స్ట్ స్లైడ్ అని చెప్పి మీరు స్టార్ట్ చేయండి మేడం. ఆవిడ స్టార్ట్ చేస్తారు. కంటిన్యూ చేయండి మేడం.
Formation of chorionic cavity and chorion. Small cavities appear in extraembryonic mesoderm, which later coalesce to form extraembryonic coelom and chorionic cavity. With formation of chorionic cavity, extraembryonic mesoderm has divided into two layers. The coelom is formed. In between, the mesoderm is divided into two. One which lines the yolk sac and one which is towards the trophoblast. So in between that, so many spaces are formed, all that coalesce together and forms a large cavity, and that is called as the extraembryonic coelom. The inner layer surrounds the amniotic cavity and yolk sac and is called as splanchnic layer, splanchnopluric layer of extraembryonic mesoderm, and outer layer lines the inner aspect of cytotrophoblast and is called as somatic layer of extraembryonic mesoderm. Next slide. ఇది ఇంకొక ల్యాప్టాప్ లో వేసిన వాళ్ళు చదువుతా ఉండండి అని ఇంకొక ల్యాప్టాప్ వేసి. So here, next slide, please. So your connecting stalk at embryonic disc, the extra-embryonic mesoderm does not split and forms connecting stalk, which connects the disc with cytotrophoblast. With the formation of splanchnic layer of extra-embryonic mesoderm, the size of yolk sac reduces, a part of it gets pinched off and is called as definitive secondary yolk sac. In this figure, you can see the bilaminar disc with the ectoderm, endoderm, okay, and here the amniotic cavity, the yolk sac, and the extension of cuboidal cells in the form of lining membrane of yolk sac, the trophoblast here, and this is the pink color one is the extra-embryonic mesoderm. So you can see this pink color was together, that which is lining the yolk sac and that which is lining the trophoblast was together, but so many spaces are formed in between them which coalesce together to form extra-embryonic coelom. So extra-embryonic coelom extend lining the complete chorionic cavity, and also it extends up to the region where here mesoderm is not split. So this is the region where it helps in formation of the connecting stalk. This is the region where it helps in formation of connecting stalk. So connecting stalk, future it helps in formation of the umbilical cord through which it invades the helps in formation of the placenta, and then the connection with the embryo through the umbilical cord. So here you can see the extra embryonic coelom that helps in nourishing the developing embryo. Microsoft. Next slide. Next slide. Second week.
Madam, changed already.
Next slide, next slide. That I have already explained. Another slide. Okay, now going on to the chorion. So chorion is a term used. You can see here a ring has been given here. So extra-embryonic mesoderm which lines the trophoblast along with the trophoblast is called as chorion. Okay, so the chorion has got two main functions. It protects the embryo and it also nurtures the embryo. So the trophoblast and somatopleuric layer of extra-embryonic mesoderm together forms chorion, and blastocystic cavity is called as chorionic cavity. Next. Next slide. So on the day 13 and 14, you can see the changes in the trophoblast and the embryoblast. So what changes, what you can see in the trophoblast are trophoblast, which covers completely, endometrial surface defects, heals completely. Syncytial trophoblast forms column-like structure called villi. Villi lies between adjacent lacunar spaces. Syncytial trophoblastic villi are invaded by cytotropoblastic cells, which form primary villi. Primary villi now have central core of cytotrophoblast and peripheral syncytiotrophoblast. Okay, so primary villi is now the placenta is forming now for its connection. Okay, so cytotrophoblast and peripheral syncytiotrophoblast together is called as primary villi. Now, what are the changes? What you can see in the embryoblast is there is formation of secondary yolk sac, and on the 14th day, embryo is flat. That means what? There are two plate-like structures are formed. Bilaminar germ disc is formed, sandwiched between the floor of amniotic cavity. In the floor of amniotic cavity, there will be ectodermal plate, and in the roof of the yolk sac, there will be endodermal plate. So these are the two plates or the bilaminar germ disc, what you can see at the end of the 14th day of the embryo. Next is the yolk sac. It is also called as umbilical vesicle. Yolk sac is a membranous sac. To the membranous sac attached to the embryo, formed by cells of the hypoblast adjacent to the embryonic disc. It attains maximum size on 32nd day of intrauterine life. It is visible from 5th week and it becomes invisible on USG. It gives nutrition to the embryo in 2nd and 3rd week. forms the source of primordial germ cell. Primary organ for hematopoietic germ cells. Forms gut tube, endoderm, and give rise to lung bud and also gastrointestinal duct. So it is the yolk sac which is drawn inside to form a midgut loop and a part of foregut that helps in developing the lung bud and also the gastrointestinal duct, or it is also called as intestinal duct. Next, bilaminar germ disc. Okay, next two slides. Bilaminar germ disc, that one. Okay. So here you can see the figure, bilaminar germ disc. So it's a 3D film, 3D picture, what you can see here. So you can see the blue color lining membrane. That's completely the region where it is. This is the ectoderm. This is the amniotic cell layer. The cavity is filled with the amniotic fluid. This is the connecting stalk, what you can see. And this is the splanchnopluric layer of extraembryonic mesoderm. The mesoderm also passes up to here. This is the cavity outside, but here there is no extension of the cavity, so it is attached. It is the connecting stalk. So this is the way the cells are present, hypoblast cells and the epiblast cells. Hypoblast is the region. You can see some of the hypoblast cells has become long, and this is the region where there is formation of, you can see here this shaded area. The shaded area represents the x-axis. That means what? About the x and y axis. X-axis is the region where it is going to signal the cranial end of the embryo. The columnar cells which are formed out of the cuboidal cells, the region where the ectoderm and endoderm are in intimate contact with each other and helps in formation of the procaudal plate. In future, it develops in the form of the buccopharyngeal membrane and opens out into the oral cavity, helps in connecting the cranial part of the foregut outside. Next. Next is the procaudal plate, or it's also called a precaudal plate. Epiblast cells become columnar in some areas near cranial end of the germ disc. This small circular area where hypoblast is in intimate contact with epiblast is called as procaudal plate. What I have shown you in the figure itself. Significance of procaudal plate, it shows first sign of differentiation. Procaudal plate is the first sign of differentiation. Establishes cephalocaudal axis, x and y axis, which is the head end, which is the tail end. That is done by the development or appearance of the procaudal plate. Important organizer of the head region. So in the next, you can see the figure. Okay. So you can see the yellow color ring-like structure there. So that is going to divide the body into two halves, right half and left half equally. And it also signals the head end and the tail end. Tail end will be much more when you are going to put an axis, the tail end will be at a most distal part and head end will be most nearing part it will be. So you can see here, when you take the transverse section, you can see the transverse section taken at the procaudal plate like this. So you can see here some of the cells has become columnar, and this is the region where it is not invaginated by the intraembryonic mesoderm. So there is a intimate contact between the ectoderm and endoderm that you can see as the oral cavity and extension of ectoderm from the lips inside into the oral cavity proper. Okay, next.
Madam.
Hello, Uma ma'am. Uma ma'am, she was there.
Yeah.
She was
She
there,
is there,
but Not
She is there,
speaking.
but not audible, not visible.
Not visible, not speaking. Let's see, we'll wait a minute.
Now visible, but not audible. Madam,
No?
unmute here.
No? Okay.
Yes, yes.
Okay. So in the second week of development, highlights are bilaminar germ disc formation, trophoblast, 2 cavities are formed, 2 layers of extraembryonic mesoderm, somatopluric and splanchnopluric layer of mesoderm is formed, beginning of uteroplacental circulation starts at the second week end. Next. Trophoblastic changes in the second week. You can see differentiation of the trophoblast into outer syncytial trophoblast and inner cytotrophoblast on day 8. On day 9 and 10, closure of penetrating defect, formation of multinucleated trophoblastic mass, appearance of lacunar spaces in trophoblast. Day 11 and 12, enlargement and fusion of lacunar spaces, formation of syncytial trophoblastic trabeculae, erosion of maternal vessels, filling of lacunar spaces with maternal blood, establishment of uteroplacental circulation at the end of the 12th day. Okay, day 13 and 14, formation of syncytial trophoblastic villi. Villi starts forming. Cytotropoblastic invasion in villi, you can see formation of primary stem villi. These are the changes what you can see. Next, it is the changes of embryoblast in second week. In embryoblast, what are the changes? Differentiation of embryoblast into hypoblast and epiblast, formation of amniotic cavity, formation of bilaminar germ disc. Day 9 and 10, formation of Husser's membrane. Okay, and then blastocele cavity, primary yolk sac is formed. Day 11 and 12, formation of extraembryotic mesoderm, formation of extraembryotic coelom, formation of connecting stalk. Then comes differentiation of embryoblast into somatopluric layer and splanchnopluric layer. And day 13 and 14, formation of secondary yolk sac and formation of procaudal plate. All these you can see from day 8 to day 14. Next, changes that occur in endometrium. Blastocyst sinks in endometrium due to invading capacity of the trophoblast. Blastocyst gets completely embedded in endometrium by 12th day. Site of penetration is sealed by fibrin plug and healed later by lining epithelium of endometrium. Buries in stratum compactum of endometrium. There are in compactum, stratum basale and stratum compactum. This compactum will wither as placenta during delivery, that sheds during childbirth. Hence called decidua. Decidua that lies deep to blastocyst is called decidua basalis. Decidua becomes edematous with glycoprotein deposits for nourishing embryo along with the tortuous uterine glands. Next. Next. Next, third week of development. Okay, wait. So now formation of the trilaminar disc formation. The characteristic events occur in the third week of development is gastrulation. So that is called as gastrulation. Gastrulation is the process that establishes all three germ layers, ectoderm, mesoderm, and endoderm. Gastrulation begins with formation of primitive streak on the 15th day on the surface of epiblast. Primitive streak appears as a narrow groove with slight bulging edge on either side in the caudal part of the midline, craniocaudal midline axis of the epiblast. Next. Third week. So here you can see the bilaminar disc formation. After the bilaminar disc formation, you can see this is the cranial end, this is the caudal end. In the caudal end, in the epiblast, or you can also call it as ectoderm layer. Okay, there is the cells will differentiate. Lot of things here in this particular region here at the caudal end. The ectodermal cells are the all contain all are blast cells, so which give rise to so many derivatives. So these blast cells are develop and proliferate, and then what happens? This is the region where, so then it passes deep between the procaudal plate and this is called as primitive streak. So after that, what happens? The cells which are proliferated passes cranially, and in the cranial part of the primitive streak in this particular region, there will be a the region is called as blastopore, okay, or it is called as the pit, okay, primitive pit. So through the pit, what happens? And there is a groove which is formed in between, and on either side there will be a bulging. So what happens? The cells which get differentiated from the ectoderm, they start invaginating the primitive streak and then the blastopore and passes inside. First, through the blastopore, the axial mesoderm, which passes inside, helps in formation of the notochord, and then the other cells, the paraaxial mesoderm, all that are the mesodermal cells which develop from this primitive streak, gets invaginated between ectoderm and endoderm, passes on either side, and in between the two plates, it completely covers the complete of the region between the ectoderm and the endoderm, but procaudal plate will not get invaginated. So you can see the primitive streak which is passing inside transverse section has been taken here in the third figure, and you can see the proliferation of cells, and it is passing between the ectoderm and the endoderm. Third figure. So next is tropoblast connecting stalk, amniotic cavity exposed to show epiblast, primitive streak forming shallow groove. So in this figure, you can see the primitive streak. This is the blastopore. Okay, this is the primitive streak. This is the ectoderm. This is the amniotic cavity, what you can see here. This is the yolk sac. So it's a three-dimensional figure, what you can see here. And this is the region where there is proliferation of the cells from here. The caudal end of the ectoderm, the differentiated cells, the blast cells, passes inside and separates the ectoderm from the endoderm. Formation of primitive node in the pit, slightly elevated area or cephalic end of primitive streak is called primitive node. In the center of primitive node, there is a small depressed area called primitive pit. Cells of epiblast migrate towards the primitive streak. As it approaches streak, it gets converted into flash-shaped cells, slips and invaginate inward. That in the figure I have already explained. Next is formation of procaudal plate. As more and more cells move inwards and separates epiblast from the hypoblast, they move between these layers, germ laterally and cranially, and establish contact between the territory of the disc, with extraembryonic mesoderm covering yolk sac and amnion. In cephalic direction, they pass encircling the procaudal plate. Procaudal plate is formed between tips of the notochord and oropharyngeal membrane by some first formed cells that migrate cranially in midline. Procaudal plate is responsible for induction of forebrainwave cycle. Oropharyngeal membrane at the cranial end of the disc made up of small circular area where endoderm and the ectoderm together, which forms future opening of the oral cavity. Formation of endoderm, mesoderm, and ectoderm. Once these pluripotent cells invaginate between epiblast and hypoblast, some cell displaces cells of the hypoblast and become definitive endoderm. So here from the epiblast only definitive endoderm is also formed. First formed endoderm is not, it's a temporary one. So that is again replaced by the endodermal cells which are formed by the displacement of the cells from the epiblast, and they will help in formation of the definitive endoderm. Once newly created endoderm is formed, remaining cells between the ectoderm and the endoderm, the remaining cells deep to the epiblast and over endoderm forms intraembryonic mesoderm. So what has been invaginated from the like blast cells from the mesoderm, now this is again replaced or changed by the epiblast cells, so that which proliferate and passes inside, that helps in formation of mesoderm. So it is a now it is a definitive mesoderm which is formed. The cells of the epiblast form definitive ectoderm. So all definitive membranes are now formed before it is going to differentiate itself into derivatives of endoderm, derivatives of mesoderm, and derivatives of ectoderm. So in the appearance of procaudal plate and migration of a connecting stalk, it establishes in the form of craniocaudal axis and also ventrodorsal axis. Ventrodorsal from back to front, the craniocaudal from head to foot. Changes in the shape of the embryonic disc. You can see as there is a development, the cells will be more proliferation of the cells. Shape of the cell now changes. You can see it takes a pear-shaped structure. You can see the circular shape is now changing. This is the region of the connecting stalk, and you can see the primitive streak. Here, this is the blast cells, pluripotent cells, which invaginate, helps in extraembryonic mesoderm. You can see the primitive knot here, and in the primitive pit will also appear in the center later. And this is the region between procaudal plate and the primitive knot. The region is called as the region where the ectoderm differentiates itself into neuroectoderm. That helps in formation of the nervous system. So deep to it, from the blast primitive knot, axial mesoderm will enter and helps in formation of yellow color line. What you can see is nothing but it's a notochord which signals the development of the nervous system and also the vertebral column and the cranial cavity. The derivatives of pluripotent ectodermal cells: definitive endoderm, definitive ectoderm, intraembryonic mesoderm made up of paraxial, intermediate and lateral plate mesoderm, notochord, primitive germ cells. These are the derivatives of pluripotent ectodermal cells, which give rise to all three germ layers. Notochord. So, notochord is a midline embryonic structure that develops during third week of development from cells in caudal part of epiblast. Axial mesoderm that is present in axis develop as notochord. Extend from cranial end of primitive streak to the caudal end of the procaudal plate. So in the figure you can see primitive knot, where both the figures are there. Okay, transverse section is also there. Okay, and how you can see on the superficial, you can see here. So here you can see the primitive knot. Okay, formation and a pit formation, the primitive knot. The pit is going inside. Here this is the pit which is present in the blastopore. This is the procaudal plate. This is the primitive knot. In the primitive knot, a pit appears which is called as blastopore. And this pore will invaginate and pass inside. It helps in formation of a canal. First there will be process, means the membrane, the cells which have been proliferated from the mesodermal cells, which will pass inside in between the ectoderm and the endoderm. In that, there is extension of the pit in the form of sinus or in the form of canal. Okay, so that will form here, and that is called as notochordal process and notochordal canal. Next, you can see the further proliferation. You can see there's a transverse section taken. So here it is the notochordal process.
Madam, explain this all the layers again. Transverse section, explain detail. Yeah.
Okay. So here it is a notochordal process is formed. Notochordal means cells has been proliferated by the blastopore. Okay. So from the primitive knot, it has proliferated now. The transverse section, you can see that it has passed in between ectoderm and endoderm. So now in this, there is formation of pit. So that pit means what? Depression. That depression will extend in the form of sinus. And this sinus will extend in the form of canal now. Okay, notochordal canal. So the cells will be outside here. So now you can see here the cells which are outside, Now some of the cells will get intercalated with the endodermal cells. It gets intercalated with the endodermal cells here. This is ectoderm, this is endoderm. Now it is passing towards the endoderm. First it was outside. It was in the caudal part of the ectoderm. Now it has invaginated, passing in between ectoderm and endoderm. Now what happens? This in this figure you can see it is in the center. Now it is encircled by the cells. Now some of the cells which is lining this notochordal canal, it will get intercalated with the endoderm. Then what happens? Again it is withdrawn. Okay, so the cells here, endodermal cells, it will displace it, and again it is indrawn inside and helps in formation of the definitive notochord. Okay, so the cavity here, it will pass here and helps in formation of the hard core of cells, again reappear there, and it helps in formation of definitive notochord. So this notochord is the region which is present in the adults or after birth in the form of nucleus pulposus, which you can see in the intervertebral disc between the bodies of the vertebrae. Intervertebral disc, it's a fibrocartilaginous disc which is present, and within that there are two layers, annulus fibrosus and nucleus pulposus. Nucleus pulposus is the pulp region made up of a gelatinous material, and that is nothing but the remnants of notochord which is present after birth till death. Okay, so this is the region that is notochord. But notochord, why it forms means it's the mesodermal derivative which is formed from the axial mesoderm, and it develops and it helps in signals the formation of the nervous system and also the spine. Next, proliferation. Proliferating intraembryonic mesoderm from primitive knot and primitive stage. So in this figure, you can see the notochord in the center, formed by axial mesoderm, extending from the blastopore, okay, from the primitive knot. So on either side, from the primitive streak, from the primitive knot up to the caudal end of the plate, there was a groove which is formed, streak. This is the streak. Okay, this is the streak. So in the streak, the cells which are there, which differentiate from the ectodermal blast cells, they will pass inside, invaginate and pass inside, and they distribute themselves on either side. So in between the two plates, endoderm and ectoderm. So it passes completely from caudal to cranial. You can see here on either side. When it comes in association with the procaudal plate, it will not invaginate. Here also, notochord is not invaginated, except that in all other regions, cranial to the procaudal plate also, there is extension of intraembryonic mesoderm. This intraembryonic mesoderm is responsible for all types of derivatives like the derivatives related to the connective tissue like bone, cartilage, blood, lymph, blood vessels, all that. Okay, even in the development of the heart, everything is derived out of intraembryonic mesoderm itself. So this is the transverse section where you can see the ectoderm and the endodermal lining, and here the notochord, and on either side it is the intraembryonic mesoderm before it is differentiated into three types. That means paraxial mesoderm, intermediate, and the lateral plate mesoderm. So that is the figure. Next, subdivisions of intraembryonic mesoderm. So it is the next section. You can see mesoderm here, complete mesoderm. This brown granule type structure. It's also the mesoderm. The cavity in between the ectoderm and the endoderm. Ectoderm is going to develop in the form of epidermis. Endoderm helps in formation of the lining membrane of the gut. Okay, so between these two, what happens is the notochord is here. At the simultaneously, there will be formation of the neural tube. Okay, derived out of the ectoderm here, and they proliferate and pass inside and get separated out. First, there is neural groove formation, neural plate, then neural groove, neural canal, and then neural tube formation, which lies over the notochord. Okay, and then related to the neural tube, on either side, the mesoderm differentiate itself, condenses and differentiate itself into paraxial mesoderm. This is paraxial mesoderm. Here you can see the brown color thing here on either side of the notochord and the tail end of the so this is the spinal cord, and this is the caudal cranial end of the neural tube. Okay, So which helps in formation of brain, which helps in formation of spinal cord. Okay, so this is called as paraxial mesoderm. This paraxial mesoderm further it divides into three layers. That is the dermatome, myotome, and then the sclerotome. Dermatome helps in formation of the dermis of the skin, gets separated out and settle below the ectoderm. Okay, and that is derived out of mesoderm itself. And the myotome helps in formation of the muscles which gather around the bony spinal cord and the cranial cavity which is formed, helps in movement of the spinal cord as such. Okay, forms the axial musculature. Okay, and then the sclerotome, the cells will proliferate, encircle the neural tube. The cells from sclerotome proliferate, encircles the neural tube, and helps in formation of the vertebral column or vertebral canal, and then the body of vertebrae, the transverse process, lamina, spinous process. All these are the cells, bony cells of the vertebrae is formed by migration of the sclerotome of paraxial mesoderm around the neural tube, so that the neural tube gets protected and it further develops. So here you can see the purple color thing. It's the intermediate mesoderm which helps in formation of the urogenital organs. And here you can see the lateral plate mesoderm. Okay, lateral plate mesoderm. So the cavity is a lateral plate mesoderm, and you can see a small cavity, small cavities emerges in the lateral plate mesoderm, dividing the lateral plate mesoderm into two parts. One which is related with the ectoderm, the other one which is related with the endoderm. The lateral plate mesoderm related with ectoderm is called as somatopluric layer of intraembryonic mesoderm. This is towards the endoderm. It is called as splanchnopluric layer of intraembryonic mesoderm. And you can see at this stage already the foldings of the embryo will be occurring. That means the cranial fold, and you can see the heart which is developing here in the mesoderm. So it is a differentiation of mesoderm and formation of heart. You can see here heart tube. It emerges in the form of two tube-like structure. Then they join with one another, and then they divide into three parts. Okay, the sinus venosus, the primitive atrial chamber, primitive ventricular chamber, like that. Okay, and truncus arteriosus. All this develop in the heart tube here. Two tubular structures here, and then it invaginates the cavity here. This cavity is called as pericardial cavity. If you take a section at the level of development of heart, if you take a section at the abdominal region, this is the peritoneal cavity, and this helps in formation of organs which invaginate the peritoneal cavity like that. Next. Communication between the intraembryonic coelom and its subdivisions. Already I have told you. So you can see the septum transversum here. After the cranial folding of the embryo, it starts folding. Okay, so cranial fold, caudal fold, and the two lateral fold will occur in the third week of development. Complete gastrulation will occur. The three germ layers are formed completely. Okay, and there will be differentiation of the starting of the primitive miniature organ system will start developing now. So you can see the extraembryonic coelom here, the communication of intraembryonic coelom with the extraembryonic coelom. Okay. Next is the 4th to 8th week of development. Up to this, it is called as the early stage of the pre-embryonic period and embryonic period. Then comes the fetal period. So outline is ectodermal differentiation in the form of neuroectoderm and surface ectoderm. Then comes the mesodermal differentiation into paraxial, intermediate, and lateral plate mesoderm. Then comes the foldings of the embryo in the form of head fold, tail fold, endodermal differentiation, changes in embryonic period. Fourth. Next slide. So 4th to 8th week of development is called back. 4th to 8th week of development is called embryonic period. All germ layers, that means the derms will changing and assigning fate for development and organ formation. Germ disc gets folded and forms identifiable shape of embryo. Congenital abnormalities are formed during this period due to effect of teratogens. So differentiation of ectoderm you can see. So neuroectoderm, you can see here the neuroectoderm. In the ectoderm, in the median plane, between the procaudal plate and the blastopore, between that, some of the cells of the ectoderm will differentiate itself into neuroectodermal cells. So you can see here, these are the neuroectodermal cells. This is the junctional region between the ectoderm and the neuroectoderm, which is also called as neural crest. Okay, firm attachment of the ectoderm with endoderm at a depression of buccopharyngeal membrane, you can see, and also with the cloacal membrane. Rupture of buccopharyngeal membrane creates communication between amniotic cavity and primitive gut. So cloacal membrane divides into urogenital membrane and anal membrane. All these are the differentiation of ectoderm, what you can see. But here in the figure, how the neurulation occurs has been given. So you can see here the neural thickening of the neural plate, and then its invagination because of proliferation of cells in the neuroectoderm. So it bends down towards the notochord, forms the neural canal, and you can see the neural crest cells is also passing inside between ectoderm and ectoderm. Ectoderm is coming in close contact with each other and closes completely. Then this also separates. The neural crest cells also get separated. Neural canal is completed and gets separated. Neural canal will now called as neural tube. These are the cells which helps in formation of the peripheral nervous system. The dorsal ganglia, where the fiber, the peripheral nerves will emerge. So this is the ectoderm which gets separated, neural tube, notochord, and this is the emerging spinal nerves. Next. So these are the derivatives what you can see formed out of the ectoderm. Epidermis of skin, hair, nail, melanocytes. So sebaceous glands, and then the nail. All these are the hair is appendages of epidermis, which invaginate passes deep to the dermis, but still it's a derivative of epidermis. So along with that, the sebaceous glands and the sweat glands, epithelial lining of the mouth and the outer anus, after the pectinate line of the anal canal, what you can see in the anal canal, that is a part and parcel of epidermis, which is pain sensitive. Then comes the nervous system derived out of neuroectoderm, central nervous system and peripheral nervous system completely, neuroendocrine organs including adrenal medulla, even the retina, the internal ear, lining epithelium of the internal ear, pituitary gland, mammary gland or breast, salivary gland. All these are the derivatives which emerges in the 4th week of development. Derivatives of ectoderm again, olfactory pit, optic vesicle and the lens vesicle, otic vesicle, brachial cleft, Rathke's pouch of the pituitary gland, epithelial lining of the cheek, gums, teeth, enamel, roof of the mouth, nasal cavity and paranasal sinuses also, sensory epithelia of the eyes, including lens, ears, nose. All these are the part and parcel of derivatives of ectoderm. Next. Here you can see all the cells has been given here, which is derived out of ectoderm. Mesoderm now. Mesodermal differentiation. Paraxial mesoderm differentiate into somatomeres and somites. You see the difference here. Somatomeres and somites. Somites can be seen related to the trunk region, but somatomeres are seen above the trunk region related to the head and neck. So ultimately form the brain vesicle, spinal cord, muscles of the face and jaw, throat, skull, eye, nasal cavity, ear, skeletal muscles, dermis of skin, and bony axial skeleton. Intermediate forms kidney and sex. So intermediate mesoderm helps in formation of kidney and sex organs. Okay, male and female. Lateral plate mesoderm, formation of intraembryonic coelom, peritoneal cavity, pleural, pericardial cavity is formed by intraembryonic coelom. Fate of somatopluric, parietal layers of peritoneum, pleural and peritoneum, dermis, pectoral end of the pelvic cavities, pectoral and pelvic girdles of the limb. Fate of splanchnopluric layer, visceral layers of peritoneum, pleura and pericardium, musculature and connective tissue of heart, gut and lung. So, when the epithelial lining is derived out of endoderm of the gut, the outside the epithelial lining of the gut, the submucous coat, the muscular coat, and the serous coat, all these are formed out of the lining membrane itself, that is derived out of the mesoderm, the lining it, that is the splanchnopluric layer. Derivatives of mesoderm, connective tissue, backslide. Okay. Connective tissue, cartilage, bones, striated and smooth muscles, heart, blood and lymphatic vessels, kidney, ovary, testis, and genital duct, serous membrane lining the body cavities, spleen and cortex of the suprarenal gland. Okay. And then vasculogenesis, yolk sac, splanchnopluric layer of extraembryonic mesoderm connecting stalk cells differentiate to hemangioblast cells. So which helps in formation of blood vessels and also blood cells. That is, first it starts in the vitelline membrane. That means the yolk sac. So vitelline arteries, vitelline veins are formed. Primitive hemopoietic stem cells and endothelial precursor cells are formed out of the mesoderm, which is present outside the yolk sac in the form of splanchnopluric layer of extraembryonic mesoderm. Remember this. Then the foldings of the embryo, initially in the form of trilaminar disc, as cells in the central part of the disc multiply rapidly, overgrown central part result in folding of germ disc and form cylindrical embryo. Foldings in median plane, cephalopelvic, cranial and tail folds. Foldings in the lateral plane. So lateral foldings, when the lateral folding occur, the plate is now converted, plate is now it becomes U-shaped, then it becomes completely covered and forms a tubular structure. That is called as the gut. Or you can call it as a primitive gut. Before folding, septum transversum, a horseshoe-shaped bar of mesoderm is present, cranial most procaudal plate. That is the region where the mesoderm join with one another, anterior to the procaudal plate. It is a combination of connection of somatopluric and splanchnopluric layers. Okay, all folds converge on the ventral surface of the embryo to form hourglass constriction of yolk sac. Okay, amniotic cavity enlarges and covers embryo completely by extending into ventral part and forms tubular covering over connecting stalk. Part of yolk sac trapped within the embryo form gut and protruding part form umbilical vesicle, which protrudes. See, amniotic cavity now completely covers this on either side and extend along with the connecting stalk and forms the walls of the umbilical cord. So primitive gut is made up of foregut cranially, hindgut caudally, and midgut in the center, connecting with the vitellointestinal duct, which is the earlier yolk sac. So head fold is formed, foregut, trapped part of yolk sac in the head fold, ventral relations, buccopharyngeal membrane, pericardium, septum transversum. All these are related with the ventral relations of the primitive gut. In the dorsal relations of the primitive gut, there is a notochord and the brain vesicle. So I can see here, the blue color is the amniotic cavity. Hello? Blue color is the amniotic cavity. The red color is the region which is the ectoderm, and the white color, what you can see here, yellow color is the endoderm, and in between these two there is the intraembryonic mesoderm. So the amniotic cavity follows the cranial fold of the embryo. You can see here, this is the region, the cavity. This is nothing but the skin, ectoderm. This is intraembryonic mesoderm. This is endodermal lining. You can see now, this is the region of procaudal plate, where ectoderm and endoderm are together and helps in formation of a oral cavity by the opening in the later stages. You can see this is the septum transversum. Okay, earlier slide, please. So septum transversum, now it has been rotated. So from ventral, from which was cranial to this procaudal plate, now as the cranial fold occurs here, you can see this primordial heart passes dorsally, and the cavity which is formed here, if the cavity is formed, is the cavity formed within the septum transversum here, and this is the pericardial cavity. For the future, it is invaginated by the heart. It takes about 21 days. Next. So it is the caudal fold of the embryo. This is the region of cloaca. Okay. This is the neural tube which is forming now. Deep to the ectoderm, intraembryonic mesoderm, endoderm yellow color. You can see here, this is the allantoic diverticulum extending like this cavity is yolk sac, complete yolk sac. So yolk sac will extend, the cavity of yolk sac extend dorsally. This is the allantoic diverticulum. Now the tail fold appears. This will get folded like this. So when it gets folded like this, you can see the neural tube. Okay, the ectoderm is passing inside. Okay, mesoderm now bending towards the ventral aspect. Now this allantoic diverticulum is now passing here. So between this and this is the region where the cloacal membrane, means ectoderm and endoderm, are together. This is here, you see. So what happens? This is the region where there is formation of anal orifice and then the urethral orifice. So there will be a allantoic diverticulum. From the allantoic diverticulum, there is a septum which is formed, urorectal septum, which is going to divide this and helps in formation of two openings here. That is at the caudal end. So that happens in the caudal end of the embryo. Anterior and posterior intestinal portals are formed, which connects the foregut with the hindgut and the foregut. Next. So lateral folds you can see here. The cranial fold you have seen, caudal fold you have seen. In the lateral fold you can see the amniotic cavity completely. This is the embryo. This is the embryo. This is the neural tube, neural canal made up of CSF. This is the ependymal cells which are lining the neural tube. Notochord. This is the intraembryonic mesoderm. This is the endoderm. Endoderm yolk sac. Okay, and you see the lateral folds. It is passing like this. Okay, so here you can see the neural tube section. This is the definitive yolk sac. Okay, which is drawn inside. See the tube, how gut is formed because of the cranial fold. Okay, it becomes the flat, which was flat here. It takes a lumen or a circular shape, and this yolk sac is drawn inside to form anterior and posterior intestinal portals, and there is formation of tube. This is called as primitive gut. So on either side of primitive gut, you can see this is the region which is completely filled with the intraembryonic mesoderm. This is the endoderm, intraembryonic mesoderm. This is the region of ectoderm. This is the region of ectoderm. Okay, tube here. So like that, the coelom is formed, neural tube, notochord. This is the foregut. Okay, so this is the dorsal structures and ventral structures. You can see as the cranial end of the cranial fold and caudal fold appears, the septum, transversum, heart, everything appears in this region and it invaginates the cavity. Next. Differentiation of endoderm. Flat endoderm converted into tubular structures called primitive gut due to formation of embryonic foldings, divided into foregut, midgut, and endgut. You can see here, this is the region where it is attached and there it is extended. Endoderm gives rise to epithelial lining of trachea, bronchi and lung, gastrointestinal tract, urinary bladder and urachus, liver and pancreas, pharynx, thyroid and parathyroid gland, tympanic cavity, pharyngotympanic tube, and tonsils. All these are derived out of the endoderm itself. Fourth week of development, increase in somite number, formation of 3 brain vesicles, formation of tail and head fold. 21st day onwards, heart starts beating. 26th day, 3 pairs of pharyngeal arches appear. 27th day and 28th day, rudimentary forelimb bud. On 20th day, that means the forelimb and hind limb bud appear. Just one day, one month it takes. But the difference between the upper limb bud and the lower limb bud. Prominence of forebrain vesicle and then otic pit, lens placard appears on the 4th week of development. Next, 5th week of development, rapid growth of facial and head prominence, rapid growth of second pharyngeal arch, growth of limb buds, formation of alar and basal lamina of neural tube, olfactory placard, maxillary and frontonasal process appears in the face region, appearance of gonadal ridges. In the 6th week of development, it shows spontaneous movement, growth of brain vesicle, appearance of nasal process, rupture of buccopharyngeal membrane, development of appendix, cecum, and spleen, limb digit differentiation with the 4 days later to upper limb. That is the difference in the digit differentiation. Next, umbilical herniation can be seen in 80% of cases. 7th and 8th week of development of eye, ear, and face, well-defined limb and digits, development of kidney, development of testes and ovaries, differentiation of external genitalia, coordinated limb movement appear, start of primary ossification center, disappearance of caudal tail like eminence. So this is related with the first eight weeks of development. From 9th week, it is called as fetus. So fetal development comes in the next later stage of the embryo. I hope that I have given the brief description regarding the early stages of development of embryo and also the pre-embryonic development. Pre and embryonic development.
Thank you so much. Yeah. Thank you so much, madam. You were very much busy today. Even then, you have spared the time for us. It's really, yeah, we are really thankful to you, and it was really elaborated, and lot many things came into my mind. But now it is, I think, time for next session. So I'll personally ask you lot many things that are in my mind to ask. And one thing I can say that some disease that is fetal origin of adult disease, those are also related to this early embryonic stage, I think so.
Yeah, it is very
madam.
important. Genetic
Yes.
related problems will appear in the first trimester. That during the first 14 days of development is very crucial.
Yeah, yes,
Even
yes.
even related with the twins also, the division of like that, that also appears related to the first 14 days. During the development also, during that time also, there may be division and 2 fetuses or 4 fetuses can be formed.
Yeah, thank you, madam. Now over to Pawan sir. Pawan sir.
Hello, good evening all. I'm Dr. Dinesh.
Ji.
Okay, thank you, ma'am. Doctor, today Dr. Alok sir. Hello, am I audible?
Hello.
Yeah, audible.
Okay, ma'am. Today Dr. Alok Gupta sir will present presentation of Dr. Chiute's procedure, that is transrectal suture rectopexy. Are you there, Dr. Alok sir?
Yes, Dr. Dinesh. Good evening.
Good evening, sir. You can start now, sir.
Okay, sir. Okay. पवन कुमार सर ज्वाइन हो गए क्या?
Yes, yes.
He is there. Okay.
Yes, yes, he is there.
Okay.
सर नहीं आए सर अभी तक.
अच्छा हाँ
सर नहीं आए.
अच्छा ओके ओके ओके.
सर नहीं आए अभी तक.
गुड इवनिंग एवरीबॉडी.
Yes, yes.
जब संहिता काल था उस वक्त सारे ऋषि मुनि उस वक्त के कॉन्फ्रेंस का तद्विज संभाषा का आयोजन करते थे. तो इस युग के ऋषि मुनि हमारे डॉक्टर पवन कुमार सर, इनको मैं विनम्र अभिवादन करता हूँ कि वो सातत्य से इतने दिनों से जो वेबिनार है वो चला रहे इतने सालों से. तो उनको आज मैं मेरा विनम्र अभिवादन करता हूँ. तथा हमारे संघवी सर, वो भी प्रोक्टोलॉजी का प्रोपोगंडा करने के लिए हमेशा कॉन्फ्रेंस वेबिनार कुछ न कुछ वो ऑर्गेनाइज करते रहते हैं. तो इन सभी आयुर्वेद के ऋषि मुनि लोगों को मैं आज मेरा विनम्र अभिवादन करता हूँ और मेरे विषय को शुरुआत करता हूँ. स्लाइड शेयर करता हूँ पहले. मेरा आज का विषय है ट्रांसएनल सुचर एक्टोपेक्सी, दैट इज डॉक्टर चिउटेस प्रोसीजर फॉर हिमोरॉइड्स. ऋषि को एक मिनट के लिए.
एक मिनट साहब, मैं वेबिनार की लिंक चेंज कर रहा हूँ. धन्यवाद, बहुत बहुत धन्यवाद पुरानी वेबिनार के लिए. कामिनी जी का बहुत बहुत आभार. सभी वक्ताओं का बहुत बहुत आभार. मुझे एक मिनट दीजिए. आई
हाँ
एम
सर.
चेंजिंग द लिंक फॉर नेक्स्ट वेबिनार.